All of a sudden, I woke up with this fast heartbeat, and it became more often.
Atrial fibrillation is an abnormal heart rhythm. In some people, there's a feeling of rapid heartbeat. It can be intense enough to even cause heart failure. Oftentimes, medications won't convert from being in atrial fibrillation to regular rhythm.
Post-Ablation is more of a targeted cure for the atrial fibrillation cells. I think the future is going to be great. My daughters and I are running in a 10K race, and hopefully they'll slow down for good old dad. I'm 62 years old. I'm a cardiologist. I've been married for 29 years, and my wife is Joy. We live in Vero Beach, Florida. We have 4 daughters.
Howard is a quiet guy, but he works hard and he's very passionate about his work. We love going boating.
That's very, very relaxing for me. I was approximately in my early 40s when all of a sudden I woke up with this fast heartbeat and woke up, oh my gosh, what's going on? And it went away. I didn't think nothing of it, probably because I was maybe dehydrated or maybe stress. As time went on, I noticed that more and more I started having more palpitations, but not necessarily palpitation, but more shortness of breath. And then it became more often, almost once or twice a month. And that's when I said, this can't go on. My name is Howard, and I have atrial fibrillation, or AFib.
Atrial fibrillation is an abnormal heart rhythm that occurs in the top chambers of the heart. Instead of beating in a coordinated fashion, it is going so fast. It's a completely asynchronous and disorganized rhythm. Now, paroxysmal atrial fibrillation, or PAF, refers to intermittent atrial fibrillation, meaning it starts and stops by itself. Now, if PAF is left untreated, what happens is that over time, those episodes can become longer and longer in duration, so ultimately, they keep going. They don't stop by themselves. And if that's left untreated, it can become chronic or just continuous atrial fibrillation. The symptoms of atrial fibrillation can vary widely. It can present subtle symptoms, feeling just not quite themselves. Even more intense, it could be feeling of weakness, particularly with activity. You feel less energy or more short of breath. It can also cause changes in cognition. And ultimately, it can also cause palpitations. In some people, there's a feeling of rapid heartbeat that's very unusual. And in other people, it can be intense enough as to even cause heart dysfunction and heart failure.
I remember when I was on a treadmill, I would say, wow, I can't go as fast as I can, or my heart rate's going really super fast here. And so I would stop, and it would stop after, a few minutes. And I just said, well, maybe it's just dehydration.
He was trying to replenish it with electrolytes and all those drinks before and after, like workout, but it just continued on.
As a cardiologist, I've noticed that some of my patients also had similar symptoms with the palpitations and shortness of breath.
Hello, how are you?
In hindsight, I think Howard was kind of denying it.
Actually didn't even appreciate that he was having atrial fibrillation because his symptoms were so subtle in the beginning.
I guess for physicians, they usually try to diagnose themselves and try to treat themselves. I think that's how he is too.
Actually, one time I was in the office and I just did an EKG and I said, wow, I am in atrial fibrillation. And then I referred myself to a colleague who's a cardiologist locally. When I did get the official diagnosis of atrial fibrillation, my kids were still young at that time, so they really didn't understand that you can be doing fun things and then all of a sudden, I've got to stop. I've got atrial fibrillation. I'm gonna have to rest, sit down for a few hours. That was the big disappointment from my standpoint. I can't do what they're doing, and everything has to halt because of that disease.
When we think about what causes atrial fibrillation, there's a lot we know and a lot more we don't know, and I think we need to acknowledge that. It's very clear that there's some genetic predisposition to atrial fibrillation.
My mother had atrial fibrillation before I had my episode. She actually didn't know she had AFib. She felt fine, didn't feel anything, no palpitations, and then her first episode of AFib, unfortunately, was a stroke. I was devastated, obviously. And at that time, I didn't really realize that AFib could be passed down.
So when you think about the complications of atrial fibrillation, probably the most dangerous is a stroke. You can also have heart failure that can develop from atrial fibrillation. Now, because stroke is probably the most feared complication of atrial fibrillation, we really focus on trying to prevent stroke. So the first strategy that we use in virtually all of our patients is a blood thinner. Then, of course, we have to try to control the rhythm. We have a range of medications.
I was taking beta blockers, but also I was taking an antiarrhythmic called flecainide. It will convert you up to 4 to 6 hours.
Oftentimes, medications won't convert from being in atrial fibrillation to regular rhythm. So we do something called a cardioversion.
In 2023, I actually was running and I just became super short of breath. And I looked at my watch and I said, wow, my heart rate's going pretty fast. So I stopped and I said, whoa, I'm back in AFib. I tried my antiarrhythmic and it didn't really work. So after several hours, I was just like, well, I've got to go to the hospital and get a cardioversion. So I think that's when I realized, hey, I really think I need some cure for this atrial fibrillation.
Then we consider procedures like catheter ablation. So catheter ablation is a procedure where we take a catheter, or multiple catheters, go through the veins, typically in the legs, into the heart, to identify those locations where the atrial fibrillation is coming from. And then we can deliver energy from the tip of the catheters to basically destroy those offending areas to try to eliminate the atrial fibrillation.
I was leery about getting cardiac ablation because I've sent hundreds, if not thousands, of patients for ablations, and I see the complications.
And also at the same time, he can't just leave the practice just like that because, well, there are patients that he has to take care of.
So I was like, do I want to go through this? And then I learned a new way of ablations from actually American College of Cardiology meeting that actually Dr. Reddy was there, and he did a whole talk about it.
I've been involved with pulse-field ablation since the very beginning, from the preclinical studies that we performed at Mount Sinai, as well as a few other centers in the country.
Pulse-field ablation is more of a targeted cure for the atrial fibrillation cells rather than all the cells, and therefore you have less damage. And the biggest thing I saw was it's a safe procedure, and that was my number one goal.
Because the procedure has now become relatively quick, we oftentimes send our patients home the same day of the procedure. They recover fairly quickly. Usually within a week, they're back to their usual activities. What's interesting is that this is not just true in patients in their 50s or 60s, but also patients in their 70s or even 80s or even higher that we're now treating with pulse field energy.
So after I had my ablation, I felt fantastic. I haven't had any AFib events, nothing, not even palpitations. In fact, after ablation, 3 weeks later, I competed in a 5K run, and then I went on a 10K run, and most recently, a couple weeks ago, I did a half marathon, no episodes at all.
While pulse field ablation and catheter ablation in general is very effective, it's not perfect. There's still patients who have recurrences, and some patients do require additional ablation procedures to identify areas that didn't pop up during the initial procedure.
You still need to be on the blood thinners until approximately three to 6 months. And approximately 3 months post-ablation, I wore a 2-week event monitor to see whether or not I went in and out of atrial fibrillation.
What we see from Howard's experience and many other individuals and patients' experience is that pulse field ablation has really changed how our patients fare from atrial fibrillation. They can go from a situation where they're highly impacted to a situation where basically Howard's not even thinking about atrial fibrillation from a day-to-day fashion.
As a cardiologist, and having atrial fibrillation and having cardiac ablations, I think my patients truly relate to my experience.
Howard went through a couple of different treatment strategies, and they were all reasonable, trying medications, trying cardioversion, ultimately trying catheter ablation. And I think that each individual, if they have atrial fibrillation, needs to work with their doctor to figure out the best course of action. Fortunately, we now have some tools such as the medications and catheter ablation, and they're also increasing awareness of the importance of atrial fibrillation and the different patient support organizations that are very helpful for our patients. And I'm very hopeful for the future. Now we have not just one, but several different pulse field ablation catheters and technologies, but there are other advances that are also coming. I think we're going to see in the next few years.
I think the future's going to be great.
Howard, he's quite active. Even after the ablation, he's going to be doing a lot of physical activities, and he's been doing that with the kids.
My daughters and I are running in a 10K race in Miami, and hopefully they'll slow down for good old Dad.